Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and we're so excited to have you with us. I hope you're having a great day. I hope your family's healthy and happy. And we are so thrilled today. I'm going to be doing a special presentation on some of the things you should know that I believe is important for everybody to know. In a world where we are told the number one, two, three causes of death in America always seem to include heart disease, strokes, heart attacks. I thought it was time we put together a presentation on what you should know about cholesterol and cholesterol lowering drugs. And then what are some of the natural solutions, antidotes that science has already figured out in medicine and medical journals already know about the truth about cholesterol lowering minerals, vitamins, and something called bioflavonoids found in fruits and vegetables. You might as well know the truth, so we're going to share it with you here. All right, so I'm going to actually show a PowerPoint. I hope you'll follow along. And then remember, as always, this PowerPoint, all about cholesterol and cholesterol lowering drugs, the PowerPoint is converted into a PDF. It is free to download underneath the Patient Resources tab at thedrardisshow.com. So if you find this actually beneficial, go to thedrardisshow.com, forward the link, let people know, anyone you know and love that might be on these medications or have concerns about cholesterol in general. They want to know the truth and you want to share it with them, tell them to go to the Patient Resources tab at thedrardisshow.com. All right, let's dive in. Here is the truth about cholesterol and drugs by yours truly, Dr. Brian Ardis. You can scan this QR code. You actually will put in your email, and then we will notify you each week, anytime we have a new presentation, a speaking event, book signing, doesn't matter, new podcast that we've just put online. We wanted you to know, and you want to be in the know. Make sure you scan that QR code, put in your email, and you will know and be up to date on when we're producing anything. All right, per the American Heart Association, this is right off their website, we're going to define what cholesterol is. All right, so here underneath their article titled, What is Cholesterol? They state cholesterol is a waxy substance throughout the body. It's not bad, they say, unless you have too much of it. Your body needs it to build cells and make vitamins and other hormones. But too much cholesterol, they say, can pose a problem. Cholesterol comes from two sources. Your liver makes all the cholesterol you need. The remainder of the cholesterol in your body comes from foods from animals. For example, they say meat, poultry, and dairy products all contain dietary cholesterol. On the American Heart Association's website, they have this digital PDF titled Consequences of High Cholesterol. High cholesterol increases your risk of health issues like heart attack and stroke, the world's top killers, they state. If high cholesterol is left untreated, it can lead to a higher risk or complications with these scenarios: cardiovascular disease, stroke. Now, on the left on this digital PDF, you'll see what a normal artery looks like. Then you see a cholesterol-blocked artery. Let's read what they describe cardiovascular disease to be. High cholesterol is a major risk factor for atherosclerotic cardiovascular disease, which is caused by buildup in the arteries and increases the possibility of a heart disease and stroke. I think we've all heard of plaquing in the arteries. Stroke, they also say, this means there's high amounts of bad cholesterol in your blood can block a critical path in your brain by clogging up your arteries. If the buildup gets too high, it can lead to a stroke, they say. The American Heart Association also says that high cholesterol can lead to complications with diabetes. Diabetes, they say, can put a dent in your good cholesterol and increase the amount of bad cholesterol in your blood, increasing your risk of heart attack and stroke. Also, artery disease, peripheral artery disease, narrows your arteries and reduces blood away from your heart to other parts of your body. High cholesterol increases your risk of PAD, peripheral artery disease. Peripheral just means away from the body, and can also narrow critical pathways through your arteries. They also mention that if you have high cholesterol, it can make complications like high blood pressure. High blood pressure can damage your blood vessels, where the bad kind of cholesterol, LDL, can build up and narrow your arteries. Then they state, lower your cholesterol to lower your risk. And I just highlight one statement. Talk to your healthcare professional about the best treatment plan for you. Well, what do you think those treatment plans include? First, before I dive into what medical doctors are going to recommend to you, I want to take from a PowerPoint that is already online at slideserve.com what is summarized to be some of the functions of cholesterol. Now, this is just one slide from the presenter who did this, but I thought it was a very quick summary of what are the functions of cholesterol. Why did God or Mother Nature make your body make cholesterol? Number one, it is required to build and maintain cell membranes. Did you know you can't make any cells in your body? New ones, damaged, those with cancer, those that are infected. Your body always lays down new cells. Did you know your body needs cholesterol to do that? Did you know cholesterol aids in the manufacturing of bile, which helps digest fats? So you can't digest fat without cholesterol to make bile in your liver, stored in your gallbladder. Did you know that cholesterol is important for the metabolism of fat-soluble vitamins that include vitamins A, vitamins D, vitamin E, and vitamin K? Did you know you needed cholesterol to do that? Did you know that cholesterol is the major precursor for the synthesis, the manufacturing of vitamin D and of the various steroid hormones, which include cortisol, your stress hormone, aldosterone in the adrenal glands, and even your sex hormones like progesterone, estrogen, and testosterone? Did you know you needed cholesterol to even make progesterone, estrogen, and testosterone? Well, how many people do you know struggle with these hormone imbalances when in fact many of them might be on cholesterol lowering drugs or on low fat diets, lowering cholesterol production, leading to worsening hormone imbalance? I don't know if you know this. Did you know that there's a direct correlation to lowering your cholesterol and erectile dysfunction and lower sex drive? Why? Testosterone drives both, and you need cholesterol to produce it. Did you also know they have stated down here that further recent research shows that cholesterol has an important role for the brain synapses as well as in the immune system, including protecting against cancer? Well, if that's true, what do you think happens when you reduce cholesterol with statin drugs or lower the fat content in your diet? Now you're producing less cholesterol in the body and you're 20 years ago, I read a book called The Cholesterol Hoax by Dr. Sherry A. Rogers, MD. And before I even get started, any of you who are like, you know what? I'm going to listen to this, but I'd like to learn more. This is the book. Go buy the book, The Cholesterol Hoax, the summary of all the hoax and lies about cholesterol and the good and bad cholesterol. All of it is summarized by this incredible MD with incredible research. You can easily go to Amazon or anywhere online and buy The Cholesterol Hoax. In fact, you can probably buy it at half-price bookstore. All right, the Mayo Clinic defines high cholesterol, and we're just going to show you what the various forms of cholesterol are. When you look below, you'll see how they diagnose it. They'll take a blood test, check your cholesterol levels, and this is called a lipid panel or lipid profile. And when you look at your blood work, you will typically see these four indicators they're looking for to assess your cholesterol levels. You'll see a total cholesterol number on your blood work. You'll see an LDL cholesterol, which you all know is to be bad cholesterol, HDL cholesterol, that they want you to believe is good cholesterol, and triglycerides, which is a type of fat in your blood. Interpreting the numbers. I'm going to show you this because anybody out there going, I wonder if I have high cholesterol or not. I don't even know what these numbers mean. I'm just going to show you what it is the Mayo Clinic has published right now on their website are the desirable or best numbers, they say medically, for cholesterol. So first we're going to look at total cholesterol in the United States and some other countries. And what you learn at the Mayo Clinic is that they actually have different measurements for cholesterol in different countries. So we're going to focus on US and those other countries that use the same benchmarks as the United States because it's easier for reference. They state for total cholesterol that below 200 milligrams per deciliter of blood is the most desirable. If you're in Canada or most of Europe, it's below 5.2 millimoles per liter is their measurement, is what they say is the best. Now, for a lot of you, you may not know this. Did you know this number for total cholesterol to be considered good. Did you know that when cholesterol drugs first came out, that the desirable number was less than 300? Do you know that over the last 30 years, they keep dropping this number lower and lower and lower? And do you know what that does? It lets them prescribe more cholesterol busting drugs. We're going to continue with interpreting the numbers. Total cholesterol we already looked at. This is LDL cholesterol that you will see on your blood report. And I just want you to see the very first one is below 70 milligrams per deciliter. They recommend this is the number best for people who have coronary artery disease, including a history of heart attacks, chest pain, stents, or coronaries bypass. Below 100 milligrams per deciliter is what they say is optimal for people at risk of coronary artery disease or have diabetes. And you'll just see the rest of the numbers for LDL. The higher it goes, the worse they say it is. Now, HDL cholesterol is what they call good cholesterol. LDL is what they like to reference as bad cholesterol. HDL cholesterol in the United States and those countries using the same milligrams per deciliter, they tell you the better number is anywhere between 40 and 59 on your blood work. Milligrams per deciliter for men is better. For women, it's 50 to 59 milligrams per deciliter. But the best, they say, sorry, I didn't highlight that correctly. The best is actually 60 milligrams per deciliter and above. When you get to triglycerides, triglycerides are fats in the blood. They show you here that the most desirable is below 150 milligrams per deciliter. So these are just the references on your blood work. When it comes to treatment, I want to highlight what they state under treatment. They state lifestyle changes, such as exercising and eating a healthy diet, are the first line of defense against high cholesterol. Okay, I just want y'all to think for a minute. How many people do you know have gone to their medical doctor, they took their blood work, looked at you, and then gave you a booklet with exercising or exercises describing how to lower your cholesterol? Or gave you a booklet that included the foods you should be eating and the foods you should be avoiding to lower your cholesterol? Because what the Mayo Clinic says is lifestyle changes, such as exercising and eating a healthy diet, are the first line of defense against high cholesterol. I just want you to know, I have interviewed thousands of MDs around the world, tens of thousands of patients around the world. None of them were given exercises to lower cholesterol, nor were they given dietary recommendations to reverse cholesterol. In fact, they were only given what you see on the screen, a drug. But Mayo Clinic says if you've made these important lifestyle changes and your cholesterol levels remain high, your doctor might recommend medication. Of course they might. Statins they list. Statins block a substance in your liver needed to make cholesterol. This causes your liver to remove cholesterol from your blood. Choices of statin drugs include atorvastatin, which is the generic name for Lipitor, fluvastatin, which is the generic name for Lescal, lovastatin, which is the brand name Altoprev, pitavastatin, which is Livalo, pravastatin, which is Pravachol, rosuvastatin, which is Crestor, and simvastatin, which you all know as Zocor. These are some other medications they prescribe, medical doctors will, for high cholesterol. I am not going to read these paragraphs. I'm not even going to describe them. But I did want to make sure you saw these because some of you might know are on these. Cholesterol absorption inhibitors is another drug often prescribed for high cholesterol. Bempedoic acid is another type of drug. Bile acid binding resins is another prescription medication given to lower cholesterol. And then another form of drug for cholesterol lowering is PCSK9 inhibitors. I would like to read to you the last statement summarizing what these medications are. They are injected under the skin every few weeks and are expensive. That's all you got to know about the PCSK9 inhibitors. Then we go to medications for high triglycerides. These include what are called fibrates, niacin, which is vitamin B3, by the way, and then omega-3 fatty acid supplements. Did you know if you have high triglycerides that niacin, a B vitamin, and omega-3 fatty acid supplements can lower high triglycerides? And were you recommended those by your medical professional? This is the Cleveland Clinic. Anti-hyperlipidemic. Now, anti means opposite of, hyperlipid means high blood fat. So this is high cholesterol lowering efforts. What are, per the Cleveland Clinic, what are anti-hyperlipid, high amounts of fats in the blood drugs? Anti-hyperlipidemic drugs are medicines that help you lower your cholesterol levels. Many people have high cholesterol because of, they state, a lack of exercise, a genetic issue, or they're eating a whole bunch of saturated fat and foods and fried foods. What drugs are anti-hyperlipidemic, says the Cleveland Clinic? Those include statins, like I just mentioned, which include Lipitor, Crestor, Zocor, and others. PCSK9 that I just showed you, inject every couple of weeks and are very expensive. Fibric acid derivatives or fibrates. You'll see Tricor, Lopid, Antara, and others. Bile acid or bile acid resins. You'll see the names of them there. Nicotinic acid or niacin, called Niacor or Niaspan. Selective cholesterol absorption inhibitors like Zetia and Nexflix. No, just kidding. Nexlizet. And then omega-3 fatty acids and fatty acid esters. Lovaza, Epinova. And then adenosine triphosphate, ATP, citrate lyase inhibitors like Nexlizet and Nexletol. How common are these medications? Anti-hyperlipidemic medications are very common, especially statins. Tens of millions of people have taken statins since the first one went on the market in 1987. How do these drugs reduce cholesterol? Well, they're different and they work in different ways. Number one, they keep your liver from accessing something it's used to make cholesterol. That's what statins do. They stop your body from absorbing cholesterol. They slow down or reduce cholesterol production, or they help your liver break down cholesterol, or they help your body make more of the good cholesterol called HDL cholesterol. Now let's dive into the truth about these anti-hyperlipidemic drugs, which are cholesterol-lowering drugs. We already highlighted what are the different types of cholesterol-lowering drugs, but the three most prescribed are the three you see underlined: statins, PCSK9 inhibitors, and fibrates. So let's dive into the statins first. Let's look at Lipitor. Generic name, atorvastatin. Lipitor is by far the most prescribed statin drug in the world. Did you know that it is published skin reactions can occur just from taking it? Up to 1% of all people will develop rashes, pruritus, urticaria, alopecia, loss of hair, angioedema. Angioedema, I'm not sure if you guys know this. They say it's a rare occurrence, but I'm just going to show you what it looks like. This is angioedema, swelling of the eyes, lips, face, body parts. Now we're going to look at bullous rashes, bullous dermatitis. This is what bullous rashes or bullous dermatitis looks like. I don't know why it's hung up on this, but we're going to go to gynecomastia. This is gynecomastia. Gynecomastia is a published side effect that occurs in people after the human trials are done. So if after the trials are finished and they're done collecting all the side effects, people in those trials will be followed up later. And it is reported that men on cholesterol drugs, some of them start growing breasts. I don't know if you knew this, but 10% or more of people on Lipitor will develop chronic diarrhea. In fact, the exact percentage is 14.1% of all of them. 10% of, that's a very common side effect, by the way. Another common, up to 10% of all people will develop nausea, flatulence, and constipation as a result of taking Lipitor. For the genitourinary systems, 10% of all people on Lipitor, it has been found, will have a urinary tract infection as a result of taking Lipitor. Thrombocytopenia is another side effect published of Lipitor. Don't know if you know what that is, but that's blood clots. Did you know that jaundice is a reported side effect of Lipitor? Did you know that abnormal liver enzymes on your blood work are also common side effects of Lipitor? And did you know allergic reactions, including anaphylaxis, can occur in 1 out of 10 people who are on Lipitor? This is jaundice. You'll see the yellow eyes. This is anaphylaxis. You're seeing rashes and hives all over the body. This is metabolic. Did you know up to 10% of all people on Lipitor develop diabetes or high blood sugar? It's not a genetic problem. It's caused by Lipitor. Did you know that very common, up to 10% will be diagnosed with arthralgia after starting Lipitor? How many of you knew that arthralgia, which is joint pain, muscle pain, how many of you knew that your arthritis pains may not be due to your age? Simply 11% of all people on Lipitor start developing joint pain. Did you know another 10% experience pain in extremities, musculoskeletal pain, muscle spasms, myalgia, which is muscle pain, increased CPK, joint swelling, and back pain? CPK is indicative of kidney failure, heart failure. Ask your doctor if those things are right for you. Did you know that up to 10% of people on Lipitor experience a hemorrhagic stroke? Read it. This is based on the nervous system. Analysis of Lipitor's side effects. Did you know atorvastatin, known as Lipitor, and then up to 10% of all people, 1 out of 10, could have a hemorrhagic stroke caused by their drug? Did you know that ocular myasthenia is an actual side effect? Do you know what it even looks like? Well, I'm going to show you. This is what it looks like. One eyelid's actually paralyzed compared to the other. Did you know deafness and hearing loss occurs in 1% of all people on Lipitor? When you're talking about millions of people, this is hundreds of thousands of people. Did you know that there's a psychiatric assessment for people on Lipitor? Did you know up to 10% will have insomnia, won't be able to sleep through the night? It is not a Lunesta deficiency or old age. It's the drug doing it. Did you know you need cholesterol to make serotonin, to make other hormones to help you sleep, and melatonin? 1% of people will experience nightmares, and more people are experiencing depression after the trials, still being on Lipitor. Well, I just mentioned that cholesterol is required to make serotonin. Serotonin is our feel-good, happy hormone. Guess what happens when you take a drug that reduces cholesterol? You have lower serotonin. You're not going to be as happy. Did you know that acute kidney injury is reported after the trials for people taking the drug longer than these 3, 6, 12-month periods of a drug trial for Lipitor? Did you know that up to 12.9% of everybody on Lipitor will experience common cold symptoms called nasopharyngitis? That's a fancy Latin term for the common cold symptoms or flu-like symptoms. Did you know it's very common to have pharyngeal-laryngeal pain? That's throat pain. Sounds horrible. And up to 10% of all people. Look at the post-marketing reports. This is after the trials are over. Anybody continuing Lipitor, there's much reports of interstitial lung diseases. Here's Crestor, otherwise known as rosuvastatin. That's the generic name. Let's look at Crestor. That's what it looks like. Crestor, what are some of the serious side effects of Crestor per drugs.com? Muscle pain, tenderness and weakness, also called myopathy. Serious side effects include acute kidney failure, liver problems, depression, allergic reactions, angioedema, swelling of the face, inflammation of the pancreas called pancreatitis, which is horrifically debilitating. Serious side effects also include thrombocytopenia, which is a low blood platelet count, weakness, numbness, and pain, often in the hands and feet, peripheral neuropathy. How many people are walking around with neuropathy in their hands and feet being told it's caused by diabetes or genetic, when in fact it's caused by the cholesterol drug they're swallowing every day? Look at this. Crestor even has published serious side effects of causing scarring of the lung tissue called interstitial lung disease, which, by the way, requires a lung transplant eventually. Did you know diabetes mellitus is a serious side effect of Crestor, type 2 diabetes? And elevations in your hemoglobin A1C are directly caused by cholesterol drugs? How many of you know somebody on cholesterol drugs who can't get their blood sugar down or their hemoglobin A1C down? Did you know that cholesterol drugs cause increased hemoglobin A1C to make it look like your diabetes is worse and make your diabetes worse? Incredible. Look at this next bullet point. Did you know that Crestor causes immune-mediated necrotizing myopathy, which by definition is a bunch of Latin scientific terms, which means in English, cell death in the muscles that cause weakness and fatigue? Did you know that Crestor is also published to have a serious side effect of memory loss, forgetfulness, amnesia, memory impairment, and confusion? Read the next line. Cognitive impairment has been reported with all statins. Ask your doctor if cognitive impairment is right for you when they say you need a statin drug. The number one side effect I saw in practice with anybody taking cholesterol drugs was always muscle pain. I'm a chiropractor. People would come there all the time with back pain. If I looked at their intake form and they were on a statin drug, I simply asked them, when did your back pain start, or pain in any other part of their body? And which of these cholesterol drugs, when did you start them? Almost 95% of the time, the prescription medication preceded their muscle pain or body pain. And if that was ever the case, this is what I told every patient. Just go home for 2 weeks, stop taking your cholesterol drug, and come back and tell me if your muscle pain is better. And all the time it was. Cholesterol drugs like Crestor cause muscle damage with statins, can be serious, and may rarely cause kidney problems that could lead to death. Did you know that cholesterol drugs can lead to death by causing kidney failure and muscle damage? Did you see the note here that we highlighted for you? Muscle problems can continue even after stopping Crestor? That sounds great. Liver problems. You might want to call your doctor. They say if you're on Crestor and you have any of these symptoms, if you feel more tired, have pain in your upper belly area where your liver is, have dark colored urine, that's kidney failure. Notice that your skin or the whites of your eyes are turning yellow. That's jaundice. Allergic reactions to Crestor. These include rashes, itching, hives, trouble breathing, fast heartbeat, redness or flushing, swelling under the skin or around the face or eyes or throat called angioedema. Let's look at Zocor. Its generic name is simvastatin. This is what Zocor looks like. Zocor's musculoskeletal effects. Up to 10% of everybody on Zocor will experience muscle pain called myalgia. If you look, I highlighted, dermatomyositis is another published side effect of Zocor beyond the trial periods where they were assessing side effects. But people that continued it reported dermatomyositis. What does that look like? It looks like this. Ask your doctor if this look is better than just having high cholesterol. The liver itself, with Zocor, common liver side effects. Up to 10% of people will have elevations in their liver enzymes on their blood work. For gastrointestinal side effects of Zocor, you'll see up to 10% will have constipation, flatulence, diarrhea, and abdominal pain and gastritis. Some people even experience anorexia and pancreatitis and vomiting. Liver side effects: hemolytic anemia, sounds horrible, thrombocytopenia, and thrombotic thrombocytopenic purpura, little bitty purple dots all over the body. The kidneys: myoglobinuria, acute renal failure, secondary to rhabdomyolysis. And then I want you to look down here. For the heart, did you know 10% of all people on Zocor may report chest pain, swelling, and atrial fibrillation? Oh my God, I had Dr. Peter McCullough in my in my podcast studio last year in October, which is called National Atrial Fibrillation Month. Did you know cholesterol-lowering drugs are known in 1 out of 10 people taking them to cause atrial fibrillation? Next time your doctor says your cholesterol levels are getting high and I think you need some Zocor, you might want to ask him, hey doc, are you telling me that atrial fibrillation is right for me? What about your nervous system? Did you know Zocor in 10% of all people, they may experience headaches and vertigo, cognitive impairment, dizziness and confusion. For the skin, 10% of people on Zocor will experience eczema symptoms. Do you know what Stevens-Johnson syndrome is? We don't know what percentage of people on Zocor have this, but people on Zocor beyond the human trials report this symptom, Stevens-Johnson syndrome. Well, I'm going to show you what it is. This is what it looks like. Next time your doctor recommends Zocor, why don't you ask him, are you telling me that Stevens-Johnson syndrome is right for me? Anaphylaxis, angioedema, fever, chills, flushing, malaise, being extremely fatigued, all reported side effects of Zocor. Did you know that the cells of the muscles in your body could die as a result of Zocor? That's what immune-mediated necrotizing myopathy is, and that is a published side effect. If you look under eyes, ocular, did you know Zocor has, beyond the human trials, people on it, high amounts of them, report, I'm developing cataracts and eye pain, ophthalmoplegia. Urinary tract infections in up to 10% of all people on Zocor. Ooh, look at this. How about those? Did you know that cholesterol drugs have a correlation to cancers? Did you know while on Zocor, for example, after the human trials, if they continued it, a high amount of people develop tumors in the liver, thyroid, and lungs, various cancers? Ask your doctor if cancer is right for you. Did you know up to 10% of people on Zocor, it's common they will develop diabetes? Did you know Zocor, cholesterol-lowering drug, causes diabetes in 10% of all people? Did you know that you could develop in 10% of all people taking Zocor? It is reported in the clinical trials. Develop respiratory tract infections, bronchitis, and sinusitis. Your cholesterol might be coming down, but you can't breathe. Praluent. This is another drug called alrocumab. That's a monoclonal antibody, by the way, and you'll see the drug class is the PCSK9 inhibitors. That's what it looks like. All right, hypersensitivity, up to 10% of people using this can develop what's called nummular eczema. Do you know what that looks like? I'm going to show you. It looks like that. Did you know angioedema can form in these people too? And this is what it looks like. We've already showed those. Did you know that 10% of people on these PCSK9 inhibitors will develop nasopharyngitis? 11% of them, all reported in trials, developed common cold flu symptoms the whole time they were on it. Did you know up to 10% of all people will develop urinary tract infections chronically while on that drug? Did you know another 10% will have elevated liver enzymes? How about Tricor, which is the #1 prescribed fibrate. Fenofibrate is the generic name, by the way. But this is the fibric acid derivatives cholesterol drug category. That's what it looks like. Comes in a tablet form. Serious side effects of Tricor include up to 10% will develop anti-drug antibodies and neutralizing antibodies that destroy it. You'll see flu-like illness there. It's very common. Up to 10% of people on Tricor will develop muscle pain, muscle spasm, confusion, and musculoskeletal pain all over. Serious side effects for the liver include up to 10% of people will have abnormal liver function tests. That means their AST will be increased and their ALT will be increased on their blood work. As far as the lungs go, the very common side effects of Tricor include up to 10% of people or more. It's actually 16% of all of them will develop bronchitis while on Tricor. Tricor causes the bronchitis. Tricor in 23% of all people, that's 1 in 4, will develop rhinitis, runny noses, looking like a cold. Up to 10% of them will develop a respiratory disorder, pharyngitis, or sinusitis. And look at that, up to 1% of all people on it will develop pulmonary embolism. You know what's amazing about that? Tricor is supposed to reduce your amount of blood clots. Up to 1% of all people on the drug develop pulmonary embolisms, which is a blood clot in your lungs. Muscle pain, over 10%. 25% will experience joint pains, and you will be diagnosed with arthritis and told it was genetic and it's age-related, when in fact it's Tricor related. Ask your doctor when they actually prescribe Tricor if joint pain and arthritis and autoimmune disease are right for you. And then 15% of all people on Tricor will experience back pain. Chiropractor, anybody? Upwards of 10% of all people will experience back pain and muscle pain. Definitely. For the GI, the digestive tract, for Tricor, did you know 16% of you will develop abdominal pain? I don't know anybody that likes that. How about a very common side effect is nausea, constipation, diarrhea, vomiting, and flatulence in up to 10% of all people on Tricor? Did you know up to 10% of all people on Tricor develop headaches and dizziness? Did you know that the skin, up to 10% of all people will develop what's called urticaria or rashes? Let me show you what urticaria looks like. It looks like that. Red welts all over the body. Alopecia is another side effect of Tricor. I'm just going to show you that in case you haven't seen it. There's alopecia. And then for the liver, we're going to highlight a few of these. But for the eyes, I want to talk about conjunctivitis. Conjunctivitis is pink eye. Pink eye is a common side effect for those on Tricor. And this is what it looks like. How about this for side effects? Anybody out there interested in accidental injuries increasing? Read the first statement. Tricor has a very common side effect. 18.4%, almost 20%, that's 1 out of every 5 people put on this drug, will experience accidental injuries. 18% of you will develop flu syndromes, and over 10% of you will develop chest pain. Well, how do you know that chest pain isn't a heart attack? Thought that's what they were giving you Tricor for, to try to prevent. Look at this. Over 10% of you, or up to 10% of you, will experience CPK increases, malaise, vertigo, and fatigue. Diabetes mellitus is reported with Tricor, renal failure, insomnia, diabetes. Now, let's dive into what are some natural alternatives that didn't have all that crappy side effects to it. Let's talk about treating cholesterol naturally. And I hope this isn't too overwhelming for you. I'm going to dive into some very specific highlights of a group of research studies over about 5 or 6 different vitamins and minerals and herbs that are published to lower cholesterol all naturally without any of those horrible side effects you just listened to. All right, so let's dive in. All right, so this is a research study. Remember, if this is too intense for you, you can't follow along. Just remember, you can download the whole PDF, forward it to somebody else, and then fast forward to the end or scroll to the end of the PDF, and you can see my recommendations supplementary-wise of what you can do along with diet and exercise to improve your overall cholesterol levels. But as far as options, let's look at this first. This is a study from the NIH's website titled The Effects of Combining Magnesium and Zinc Supplementation on Metabolic Status in Patients with Type 2 Diabetes and Coronary Heart Disease. The patients were randomly assigned into 2 treatment groups, one taking 250 milligrams per day of magnesium and 150 milligrams per day zinc, containing 30 milligrams of elementary zinc, or a placebo. So I'm going to define that again. There was only 2 groups. One group took 250 milligrams per day of magnesium. The other group took enough zinc sulfate that they were getting 30 milligrams of the zinc in combination with the magnesium. The other group was given starch as a placebo. And they wanted to know what happened to these people. The magnesium and zinc co-supplementations significantly reduced fasting plasma glucose and insulin levels, and it significantly increased the levels of good cholesterol called HDL cholesterol. Magnesium plus zinc taking was associated with a significant decrease in C-reactive protein, which is an inflammatory marker for your heart, and TAC. So I just want to all see this. TAC is total antioxidant capacity in the blood. What was the impact of magnesium plus zinc supplementation on blood sugar control and lipoproteins like cholesterol? This study showed that magnesium plus zinc supplements in subjects with coronary heart disease and type 2 diabetes during 12 weeks caused a significant decrease in glucose in the blood and insulin levels, and a significant increase in the good cholesterol called HDL cholesterol. They further state that a meta-analysis looking at several research studies indicated that magnesium intake is associated with a significant improvement in fasting plasma glucose, your blood sugar, triglycerides, another cholesterol, HDL cholesterol, and LDL cholesterol levels. All by itself, they are referencing there's a whole bunch of studies out there that magnesium supplementation by itself, which I always recommend 500 milligrams of magnesium a day to everybody at a bare minimum, improves all cholesterol numbers in the blood. Then they're going to reference a few other studies, and I want to highlight these to kind of drive this home. In a study on pregnant women with gestational diabetes who were taking as a supplement magnesium oxide at 250 milligrams a day during 6 weeks, a significant improvement in their blood glucose, insulin concentration, and triglyceride levels occurred. Supplementing zinc to patients with type 2 diabetes has been associated with a considerable decrease of blood glucose, hemoglobin A1C, total cholesterol, and a significant increase of HDL cholesterol. Other studies show that zinc supplemented at 30 milligrams per day of zinc sulfate during 6 months improved fasting plasma glucose, blood sugar, insulin resistance, type 2 diabetes, insulin sensitivity, and decreased triglyceride levels without causing any significant changes in LDL cholesterol and HDL cholesterol. So you're learning that they've already done multiple studies and proven magnesium and zinc together or alone improve all cholesterol level numbers and blood sugar, as you're learning. A combination of magnesium and zinc and calcium and vitamin D during a 12-week period has also been associated with a significant decrease in insulin, triglycerides, total cholesterol, and a significant increase in other blood scores looking at cholesterol called quickie scores. Magnesium is one of the crucial cofactors in the enzymatic processes that require ATP and kinase, and therefore it plays an important role in blood sugar metabolism. Magnesium also contributes to lipoprotein metabolism, cholesterol metabolism, by modulating what they call HMG-CoA reductase enzyme. Do not learn what that is. That's something God put in your body. You give your body magnesium, God's designed body knows exactly what to do with this reductase enzyme to help reduce cholesterol levels in your body. 500 milligrams a day, minimum. Zinc is also involved in a range of functions, including insulin receptor signal transduction, secretion in tissues, organelle distribution, and inhibition of protein tyrosine phosphates, reducing antioxidant load, everybody, making you healthier. They even write that zinc may increase blood sugar transport into your cells and the ways in which it does it. They describe it there if you want to study more. This study, they summarized, showed a significant decrease in the blood inflammation marker for even heart attacks called CRP, and a significant increase of total antioxidant capacity and total nitrite as a result of combined magnesium and zinc supplementation in the patients with congestive or coronary heart disease and type 2 diabetes during a 12-week period. So all of you, you're going to see at the end of this, I'm going to recommend magnesium. I'm going to recommend zinc. Magnesium, 500 milligrams. Zinc is going to be 30 milligrams a day. I'm going to read the last sentence on the screen. Magnesium, zinc, calcium, vitamin D supplementation for 12 weeks in women with PCOS. All you women out there watching or know somebody with PCOS, was associated with a decrease in CRP levels, which then reflects in less PCOS symptoms. In another study, magnesium, zinc, calcium, and vitamin D supplementation caused a significant decrease overall in CRP and what's called MDA. These are all indicators of disease of all kinds. Just wanted to drive these home for you. The combined magnesium and zinc supplementation during 12 weeks had beneficial effects on blood sugar, insulin, total nitrite, HDL cholesterol levels, C-reactive protein levels, which is a heart attack marker, TAC levels, which is antioxidant levels, BDI and BAI scores. The next study is titled Comparative Efficacy of Magnesium and Potassium Towards Cholesterol and the Quality of Life in Patients with Type 2 Diabetes. Now, if you don't have type 2 diabetes, don't think this doesn't apply to you. This goes for anybody. They're just telling you this also works incredibly well in the diabetic model. 4 groups of patients were exposed to medical treatments for 60 days. Group 1 was the control placebo group that consisted of patients who received starch at 250 milligrams twice a day as supplements. Group 2 received magnesium supplements, which was 250 milligrams twice a day. And Group 3 received potassium supplements, 250 milligrams a day, twice a day. And Group 4, they got both magnesium and potassium medication in form of a product from a company called Bionta, 250 milligrams times 2 each. This is straight out of the study. Look at the table. You're going to see Group 1, T1, was the placebo group. They just gave them starch. You'll see the cholesterol level at the beginning was 217 total. At the end was 183. When you look at the magnesium group, their average beginning cholesterol was 211. They gave them 250 milligrams of magnesium twice a day, and their total cholesterol went down to 171, well below that 200 number they want you to try to get to. Ask your doctor if magnesium is right for you. And maybe why don't you ask them, why didn't you recommend magnesium instead of Zocor, Lipitor, and all the other ones? Let's go to potassium. Potassium one, look at their average. The average beginning was 224. And at the end of these weeks in this trial, their total cholesterol went down to 163 all by itself, way below the 200. When they combined magnesium and potassium together, the average cholesterol levels in the group was 222, and it went down to 196, still below the 200 number they say is ideal or desired right now. So magnesium, potassium, just so y'all know, I do not have a potassium product. Bananas have potassium, and there are a lot of companies that sell potassium. So if you're interested in supplementing potassium, please go get potassium. I just want you to see magnesium alone, potassium alone. Individually, they did better than in combination. So if I was going to pick one, I'd pick one or the other. I wouldn't do both. I would just do one. I always prefer magnesium, but you can see potassium even had a greater influence in this study, and you may want to consider potassium. Follow the recommendations on the bottle of the supplier. The treatment had a major impact on cholesterol levels in all the 4 groups. Specifically, there was a decrease in average cholesterol levels in all the groups after the treatment, with the largest reduction seen in the 4th group, which they state is the group with magnesium and potassium. Now, the greatest difference you're seeing is the average between the 2 of them. That's what they're saying was greater in that group. Similar results, they say, were found by a researcher named Erickson, who studied the effect of vitamin C, called ascorbic acid, and magnesium supplements in 56 patients with diabetes. In that study, they observed beneficial effects of above-mentioned supplements, vitamin C and magnesium, on triglycerides and cholesterol levels in patients with diabetes. Our results of this study confirm past research showing the efficacy of magnesium in the management of stress, anxiety, and depression. In conclusion, the investigation looked at the impact of magnesium and potassium supplements on cholesterol levels in those with type 2 diabetes. These findings suggest that magnesium and potassium supplements may be beneficial in improving the lipid profile, the cholesterol profile, and overall quality of life of patients with type 2 diabetes. Ask your doctor if magnesium and potassium are right for you. Now, I've driven home the magnesium. You know about magnesium. You know about magnesium and zinc. You now know about magnesium and potassium. Now we're going to look at one of my favorite vitamins on earth that's almost overlooked by everybody until they get the sniffles, and that is vitamin C. This is a research paper off of Science Direct Medical Journal online. The effect of vitamin C supplementation on lipoprotein cholesterol, apolipoprotein, and triglyceride concentrations, looking at total cholesterol numbers in the blood. Subjects were randomized with equal probability to receive either 2 500 milligram vitamin C tablets or 2 placebo tablets per day. So they either had groups taking 500 milligrams twice a day or a group taking nothing. One each morning and one each evening for 8 months. This is an 8-month trial. Fasting blood samples were obtained at baseline, so on day 1, and at 4 months, and at the end of treatment at 8 months. Subjects in the lower 2 tertiles, those receiving the lowest amount of vitamin C, were significantly less likely to be female and had significantly lower vitamin C intakes than did subjects in the highest group. Subjects in the lowest group also had significantly lower HDL cholesterol concentrations and higher LDL, which is the bad cholesterol, and total cholesterol concentrations and fat intake. What they're saying is the lower the vitamin C group, those getting the lowest amounts of vitamin C, had higher LDL bad cholesterol and lower HDL cholesterol. So the higher the vitamin C supplemented, the better their cholesterol levels got. Here they actually summarize for you what they saw in all subjects. So you'll see all subjects is the first 2 columns. You'll see the vitamin C group and the placebo group. But at the right, you're going to see the 3 different amounts at the top of the columns, which was what they were receiving in vitamin C dosage per day. So, or those that had these amounts of vitamin C in their blood, sorry, not supplemented. Remember, they all got 500 milligrams twice a day of vitamin C. But for those who had less than 55 micromoles per liter, that's the second group of columns on the table, you see their outcomes. For those who had measurements of 55 to 79 micromoles per liter, or those greater than 80 micromoles, you see all of their results there. The blood ascorbic acid values, vitamin C, in the vitamin C treatment group rose sharply, and by month 8 were similar among subjects with higher and lower baseline blood vitamin C concentrations. And I'm going to take you through this table only in the document. You can go back and look at the previous one, but this one I want to show you. Those who were taking vitamin C and got the most vitamin C into their blood, we're going to show you those amounts. So for the less than 55 micromoles per liter, you're going to see the vitamin C level at 39 was at 39 at baseline on day 1. By day 4, their blood level was 113 of vitamin C. By 8, it was at 125. For those who had 55 to 79 micromoles per liter of blood of vitamin C, at baseline it was 68. By month 4, it went up to 112. It's almost double. And then by month 8, it was at 119. You'll notice the amount doesn't really change between month 4 and month 8. It's roughly the same, but there is a huge jump in the first 4 months of supplementing with the vitamin C. For those with 80 plus micromoles per milliliter liter of vitamin C, it went from 100 at baseline to month 4, 139. At month 8, it was 144. It only went up 5 points. There was a significant interaction between treatment and baseline or day 1 blood ascorbic acid levels for HDL cholesterol. When we stratified, measured at baseline ascorbic acid, we observed a significant difference between the treatment groups for HDL cholesterol levels. So they saw HDL really did change based on the amount of vitamin C in the blood. The final HDL cholesterol levels, your good cholesterol, were 0.1 micromoles per liter higher in the vitamin C treatment group. So the HDL levels went up the more vitamin C someone consumed. Total HDL cholesterol ratio was reduced by 8% among supplemented subjects with a baseline plasma blood ascorbic acid level less than 55. So worse outcomes in those who had less vitamin C in their blood. This is a study done on rats, and this was published in the journal called Arteriosclerosis, Thrombosis, and Vascular Biology. Look at the title. Vitamin C reduces cholesterol-induced microcirculatory changes in rabbits. The little bitty vessels in your blood, in your skin, in your fingers, toes, body, you name it. I'm not going to read this whole thing. I've already highlighted the vitamin C stuff, but I just want to show you here. Blood lipid levels, cholesterol levels, increased in the two sets of rabbits that were given cholesterol and cholesterol plus vitamin C, whereas no effect was seen on either cholesterol or triglycerides in the plasma or blood of rabbits treated with vitamin C only. So they were feeding two groups of rabbits different things. They'd give one cholesterol, then give them vitamin C at the same time. When they gave them just vitamin C alone, they saw improvements in their cholesterol. They saw changes in their triglycerides only with vitamin C. Didn't even need the cholesterol added. Vitamin C was that good. As previously described, they say, for those of you wondering if vitamin C is right for you, blood flow velocity decreased markedly during treatment with cholesterol. They fed these animals cholesterol and their arteries became blocked. So you saw a decrease in blood flow. Compared with other regimens, this decrease was highly significant when compared with the controls. Blood flow, however, was still significantly lower in the cholesterol group than in all other groups. When cholesterol was combined with vitamin C treatment, blood flow was almost identical to that of controls and significantly higher than of that of rabbits treated with cholesterol alone. Blood flow. Any of you worried about moving blood through your body, even with plaque, blockages, you name it? Did you know vitamin C improves blood velocity? Arteriolar diameter, arteries and their diameter, also decreased significantly when they fed rabbits just cholesterol treatment. This decrease was also stopped between weeks 6 and 10 and paralleled the changes in blood flow with vitamin C. After 10 weeks of treatment, there was still a significant difference in the diameter between the cholesterol treated and the untreated group of rabbits. However, check this out. Vitamin C treatment appeared to have a preventative effect on the cholesterol-induced reduction in artery diameter after 3 and 6 weeks of treatment. Excuse me, any of you out there who are worried about blood flow, worried about blood clots, worried about blood velocity, blood moving through your blood vessels as fast as possible, you just read that 2 doses of 500 milligrams of vitamin C a day increases in 3 to 6 weeks, increased blood flow, even when you're feeding rats straight cholesterol. Isn't that amazing? Ask your doctor if vitamin C is right for you when they're trying to prescribe Lipitor. Vitamin C had a protective effect on cholesterol-induced changes, and the difference in stasis between rabbits treated with cholesterol and those treated with cholesterol and vitamin C was significantly different. Cholesterol treatment also induced erythrocyte aggregation, blood clotting, in microvessels whose diameters were less than 30 nanometers. Listen to this, everybody. Cholesterol-treated rabbits, they saw blood clotting and plaquing occurring in the arteries. Read the next statement. In this case, when they did this, addition of vitamin C had a preventative effect against the blocking of blood clotting in the blood. Feeding them cholesterol to increase blood clots, they give them vitamin C and it still prevented it. Incredible. The cholesterol-inducing effects on the conjunctival, eyeballs, microcirculation in the rabbit were the same as those demonstrated in our previous work. So this wasn't the first time vitamin C was proven to do this. It reduced blood flow, decreased diameter of the arteries, increased aggregation of erythrocytes, and increased stasis. That's feeding them cholesterol. The preventative effect of vitamin C treatment on the cholesterol-induced changes in blood flow velocity was highly significant. It was highly effective, vitamin C, at restoring blood flow. The results of these measurements also support the contention that vitamin C has a preventative effect on cholesterol-induced changes in the body of a mammal. And then they make this claim. It is well established, did you know this, that vitamin C is important for cholesterol metabolism in mammals. You are a mammal person. Therefore, it is well established that vitamin C is important for cholesterol metabolism. If we got too much cholesterol inside of us, to break it down, it is required and supposedly well established by science that vitamin C is required. How many of you think your medical doctors know that? Blood cholesterol levels in rabbits after a load of dietary cholesterol is significantly reduced by vitamin C supplementation. Well, human beings in America, you guys are loading up your blood vessels with cholesterol galore and cholesterol-rich foods. you might as well start supplementing 1,000 milligrams of vitamin C. We have it at the Dr. Ardis Show, and it's all over the place. It's in your fruits. Then they describe what is the effect of vitamin C on LDL cholesterol, the bad cholesterol. The effect of vitamin C may be due to interference with either LDL oxidation or a process that is induced by oxidized LDL. 80% of the antioxidant capacity of the LDL particle can be accounted for by alpha tocopherol, which is actually a derivative of vitamin A. Then they state there is, however, a synergistic interaction between vitamin C and vitamin A, and it can be regenerated from the corresponding radical by vitamin C. Vitamin C can restore the tocopherol or vitamin A levels that help to reverse these scenarios in the blood. Human subjects with low vitamin C levels have been reported to have higher amounts of cholesterol in their blood than do subjects with high vitamin levels. I repeat, human subjects with low vitamin C levels have been reported to have higher amounts of cholesterol in blood than do subjects with high vitamin levels. That's vitamin C. Now, during COVID, a lot of you learned about this substance found in plants. It's in the colorful rinds and skins of fruits and vegetables. It's called quercetin. The title of this paper is Quercetin Protects Against Atherosclerosis by regulating the expression of PCSK9, one of those drugs they want to sell you for cholesterol, CD36, PPARY, LXRA, and ABCA1. I don't even know what those are. I was just excited about the fact that quercetin protects against atherosclerosis. So let's dive in. Quercetin modulates many processes related to the development of metabolic syndrome. In case you don't know what metabolic syndrome is, it's defined by three things: high blood pressure, high cholesterol levels, and a big fat belly. That's what metabolic syndrome is. Quercetin modulates or corrects many processes related to the development of METs, short for metabolic syndrome, such as insulin sensitivity, lipid metabolism, breaking down cholesterol and fats, and inflammation, as shown by network pharmacology research. Wow, drug research. Quercetin's not a drug, by the way. I find it interesting they're quoting that in drug studies. Our research indicates that quercetin may enhance the benefits of nutritious lifestyle, such as diet and physical activity programs, by interacting synergistically with other components. Quercetin treatment can enhance abdominal obesity generated by MSG. I don't know about you guys. If you're eating MSG, that means you're going to a whole lot of Chinese buffet places. Did you know that if you take quercetin and you're eating foods with monosodium glutamate, it can actually increase your abdominal obesity by causing imbalances in gut flora? You might want to know that. Quercetin's potential to reduce obesity, though, is associated with a decrease in fat accumulation and cell death by blocking the productions of these enzymes, MAPK and ACC. So those of you who study obesity, just know quercetin helps you dissolve fat alone. Don't eat foods with MSG in it. You just learned. I just showed you. I thought that would be important. If you're trying quercetin to lose weight and lower your cholesterol levels and you're eating MSG, monosodium glutamate, a preservative in a lot of foods, especially deli meats, you're going to gain weight. So avoid MSG with quercetin. Quercetin diminishes adipogenesis, fat-producing cells, by stimulating MAPK signaling pathway. Anybody out there want to lose some weight? You might want to start taking quercetin. Quercetin can reduce the effect of hypercholesterol on memory impairment by affecting the cholinergic system in the nervous system. It can improve your brain function. Quercetin can decrease hyperlipidemia, high blood cholesterol levels, and inflammatory processes by reducing ATP and ADP levels in the extra outside of the cell environment. Quercetin also has advantages with blood sugar. Quercetin's advantageous effect on blood glucose levels may be due to many mechanisms, including boosting glucose uptake, which is great for any diabetic and human, and boosting glucokinase activity, which promotes liver absorption of glucose and suppresses liver new making of glucose and glycogen, and it alleviates oxidative stress and pancreatic B cell damage. Pay attention, people. B cells in your pancreas are what make insulin. So if you want to prevent the breakdown of B cells, you have to take quercetin, which can play a positive role in the control of diabetes mellitus, which they say. Their conclusion about quercetin: abdominal obesity, lipid metabolism, breaking down cholesterol and fats, lipid metabolism abnormalities, and insulin resistance, type 2 diabetes, are among the diagnostic criteria for metabolic syndrome, which is one of the 8 components of life. According to the results of network pharmacology and molecular docking, quercetin may intervene in the metabolic syndrome by participating in the age-rage signaling pathway, whatever that is, in diabetic complications, lipids, and atherosclerosis as the main regulatory pathways in the metabolic syndrome scenario. We hypothesized, they said, that quercetin might regress or go backwards metabolic syndrome through food, blood glucose, and blood lipid control, therefore influencing the 8 parameters they're evaluating on the metabolic syndrome scorecard. So this is what they were evaluating. The quercetin, okay, you have to read this. This is amazing. This was the model they set up. They decided to give two groups of animals, 2 things. They wanted to give one group quercetin and the other atorvastatin, which is Lipitor, for 12 weeks. And you'll see there the quercetin water solution was 12.5 milligrams for every 2.2 pounds of body weight, and Lipitor, WADA, was 2.0 milligrams for every kilogram of body weight, respectively. The mice in the model group that they just fed and made them have diabetes and a whole bunch of fat in their diet, the mice in the model group had become overweight, had coats with dry hair and slow movements. Compared with the mice in the model group, the mice in both the quercetin and the Lipitor groups were in a relatively better condition, with shinier coats and more agile movements. Just need to remind you all watching this maybe for the first time, I've summarized this for many people. They published the reason why they study all drugs in mice before humans is all mice have the same genes humans do. And the researchers all state, medical researchers all state in their research studies, the reason why we study drugs in mice is because if we give a drug to a mouse, what happens in the mouse is going to happen in a human. So when I show you these studies, we know if it's happening to a mouse, it's going to happen inside of you. So let's look at the quercetin versus the Lipitor group. Significant differences were also observed in the quercetin and Lipitor groups. However, the differences between the quercetin and the Lipitor group were not significant. So the group they were feeding and making fat and diabetic, and the group they gave quercetin to, and the group they had Lipitor to, those 2 groups, the treated group and those that weren't treated, just made fat and unhealthy, there was a significant difference in their blood sugar and their cholesterol levels. But between the 2 groups, quercetin and Lipitor, there really wasn't much of a difference. They were almost just as great. However, I'm going to show you that quercetin actually was better than Lipitor. The quercetin and the Lipitor group exhibited significant differences compared to the model group. They state, this is what they're showing you. You'll see the bottom dark black leveled diagram is the control group. The model group is the light gray area, blue dot or light gray dots. That's the model. Those are the mice they just fed a whole bunch of fat and starch to make them fat and diabetic. Then you'll see the quercetin group and the atorvastatin group. The actual quercetin group, you'll see their levels are lower come 24 weeks. Their weight was lower in the quercetin group than the Lipitor group. You'll see the red arrows there showing you which ones are which. The blood lipid levels for the quercetin and Lipitor groups, the mice in the quercetin and Lipitor groups exhibited significant lower levels of total cholesterol, LDL, and oxidized LDL than the mice in the model group. So you saw big time improvements in LDL cholesterol, the bad cholesterol, and total cholesterol in both groups, quercetin and the Lipitor group. However, the differences between the quercetin and atorvastatin group, Lipitor, were not very significant. But I have to show you this because it's awesome. Here you will see the comparison of blood lipid levels in the C group, which was the quercetin group. You'll see I have it highlighted there. So total cholesterol went from 6.83 And then the total glucose group, 6.13, LDL 2.48, HDL was 4.39. And you can see the model group above them, right above them, the B group is the model group. So you'll see total cholesterol came down from the group that they made fat and diabetic. Total cholesterol went from 7.9 in the model group down to 6.83 in the quercetin group. Then the total glucose level went from 5.77, improved to 6.13. LDL went from 3.15, went down. That's the bad cholesterol to 2.48. HDL cholesterol went from 4.05 up to 4.39. You want the good cholesterol. And then this oxidized LDL, which is really horrific for blood clotting and heart diseases. You'll see it went from 242 down to 204 in the quercetin group. In the model group, a greater amount of plaquing in the arteries was observed at the aortic root of the heart than in the control group. Compared with the model group, the areas of atherosclerotic plaque in both the quercetin and Lipitor groups was much smaller. The area of atherosclerotic plaque didn't really differ much between the quercetin and the Lipitor group. I just want you guys to, I keep highlighting this. It wasn't any different. It wasn't significantly different. Quercetin and Lipitor had the exact same benefit. How come your doctors don't prescribe quercetin instead of Lipitor? They even show you this, and I want to show you this. They looked at the arteries in these mice, and group C, you'll see the red arrows pointing at C on each, the bar graph and the images. You'll see the enclosing of the blood clotting plaquing in the arteries. But I want you to look at something here. Look at the bar graph. A is the control group, B is the fattened mice with the diet, C is the quercetin group, D is the Lipitor group. I want to show you guys something. Look at this. This is the diameter of the arteries where blood flows through them after treating them with quercetin and Lipitor. I want you to notice something. Can you tell that the bar graph is actually smaller? It's lower in the C group. Look at this. I drew a line for you. It was actually better in the quercetin group than even Lipitor, but not so much to call it significantly different. Quercetin supplementation significantly reduced cardiac hypertrophy, enlargement of the heart, a cause of cardiovascular death and disease. Quercetin has been shown to effectively reduce the blood total cholesterol and LDL levels elevated by a high-fat diet in a separate study on rabbits and has demonstrated anti-herogenic properties. I actually don't know what that means. I have to look that up. Quercetin significantly reduces the endothelial expression of adhesion molecules, plaquing in your arteries. This study demonstrates that mice fed with a high-fat diet, quercetin treatment significantly reduced the plaquing in the arteries, lipid accumulation, cholesterol, and FC levels, and increased the collagen fibers in the plaques. In addition, quercetin treatment improved the liver microstructure, reducing the number of lipid droplets, the numbers and amounts of cholesterol. Quercetin treatment resulted in increased serum levels, blood levels of HDL cholesterol, the good cholesterol. It also increased IL-10 and decreased levels of total cholesterol, LDL, and the bad cholesterol that leads to plaquing in your arteries, supposedly. That was quercetin. Now I'm going to jump back here for a second with magnesium. This is the relationship between dietary magnesium intake, strokes, and its major risk factors for blood pressure and cholesterol. For those of you worried, this is a sub-cohort, a small group, is comprised of a representative random sample of 4,000 men and women with complete data for food diaries from the EPIC Norfolk cohort and 1,102 stroke cases. This is not a small group. This is 4,000 men and women, of which 1,102 are stroke cases. The main findings of this case cohort study of British adults suggest, after adjustment for several important confounding factors, including age, smoking status, history of coronary vascular disease, medication use, total energy intake, and other dietary variables, There was a strongly significant association between dietary magnesium supplementation and systolic blood pressure and diastolic blood pressure in men, but not in women. There was also an association with total cholesterol in both men and women, which was attenuated but remained significant after adjustment for other dietary factors. As magnesium was being supplemented, they saw a much bigger improvement in the high blood pressure markers, systolic blood pressure, the high number, diastolic blood pressure, the lower number. They saw massive improvements in men, even more than women, just supplementing magnesium. But then they also saw that even when adjusting for dietary factors, they saw total cholesterol in both men and women improved when supplementing with magnesium. Furthermore, they said in relationship to stroke risk specifically, we identified a significant decrease in risk with men with dietary magnesium intake above 354 milligrams a day. Well, what do I always recommend? 500 milligrams a day. And they said this was a significant decrease in risk for strokes in men who took over 350 milligrams of magnesium compared to those, read it on the screen, compared to those who took less than 250 milligrams a day. Actually, less than 220 milligrams a day. Supplement your magnesium, people. They published there is a significant inverse association, so the opposite, between dietary magnesium supplementation and blood pressure. Both systolic and diastolic blood pressure markers in men has also been reported. That means the higher the magnesium you supplement, the lower your blood pressure goes, both systolic and diastolic, especially in men. And they even give you the numbers there if you want to read them. Also, looking at many research studies of random control trials using oral magnesium supplements, they also reported a dose-dependent effect of supplementation on blood pressure. The more supplementing magnesium, the lower the blood pressure. It may be due to the fact that older age, higher BMI, and higher level of physical inactivity were more prevalent in women with low magnesium intakes, which may in part explain why there was a significant effect was shown in men and not women. What they're saying is it could have been an age factor. It could have been the level of activity that separated the men's outcomes and the women's outcomes from taking magnesium to reduce certain factors in the blood. A number of trials using oral magnesium supplements have reported significant reductions in blood pressure, ranging from 2 to 12 and 2 to 8 millimeters of mercury for systolic blood pressure and diastolic blood pressure, respectively. So, to break that down for you, 120 over 80 is considered normal blood pressure. What you're seeing here, the first set of numbers, 2.0 to 12.0, that means they can see just taking supplements in studies lowers the upper number, 120 being normal. That can come down anywhere from 2 to 12 points, that top number, just supplementing magnesium. And the lower number, called diastolic blood pressure, the lower number normally normal at 80, can drop by 2.7 or 8.0 levels or points. A higher magnesium intake has been related to beneficial increases in HDL cholesterol concentrations also, as you see on the screen. That's your good cholesterol, people. Magnesium has a number of metabolic roles in the body and may influence blood pressure and blood lipids, cholesterol, through different mechanisms. Magnesium may serve as a natural calcium channel blocker. Huh. Has your cardiologist recommended magnesium instead of a calcium channel blocker for your arrhythmias or a pacemaker? Also, magnesium exhibits beneficial effects on platelet coagulation. Did you know that? I mean, everybody's being put on Coumadin, warfarin, heparin, Eliquis, aspirin. Did you know that magnesium by itself helps to reduce platelet coagulation, blood clotting? And it has a potential role in vasodilation, relaxing your blood vessels, which reduces coronary artery calcification. You know, when they do the Doppler radar in your neck to look for calcified arteries in your neck, did you know magnesium reverses that? And has your medical doctor prescribed that to you? And if not, you should ask them why not. Higher magnesium intake has been associated with lower risk of type 2 diabetes, metabolic syndrome, and cardiovascular disease. Now we're going to switch gears and go to another mineral found on the periodic table of elements. This is selenium. Probiotics and selenium co-supplemented in the effects on clinical, metabolic, and genetic status in Alzheimer's disease. Now, you may not think this has anything to do with cholesterol, but it does. You're going to see it highlighted in here. Selenium supplementation compared with the placebo saw significantly reduced amounts of blood levels C-reactive protein. Also, they saw lowered LDL cholesterol and improvements in total HDL cholesterol ratio, and significantly saw increases in glutathione stimulating hormone, which reverses almost all diseases on earth. Probiotics plus selenium intake resulted in a significant reduction in blood inflammatory markers. This is even showcased in heart attacks, C-reactive protein, and glutathione, GSH levels, glutathione stimulating levels, compared with only selenium and placebo groups. So they saw a better improvement in those taking probiotics and selenium together. I do not sell a probiotic, but many people do. Global Healing's got some if you want some. I have the selenium. Subjects who received probiotics plus selenium supplements had significantly lower blood level insulin levels. They call that insulin resistant. Then compared with the only selenium group. Probiotic and selenium co-supplementation resulted in a significant reduction in blood level triglycerides, which is a cholesterol level. Did you know selenium and probiotics would do that? Did you know it also reduced LDL cholesterol and total HDL cholesterol improved compared with only the selenium and placebo group? Overall, they conclude the current study demonstrated that probiotics and selenium co-supplementation for 12 weeks, that's 3 months, to patients with Alzheimer's disease had favorable effects on their Alzheimer's score, their C-reactive protein score, their antioxidant score, their glutathione scores, markers of insulin metabolism, triglycerides improved, VLDL improved, LDLs improved, that's your bad cholesterol, total HDL cholesterol improved and got better. Incredible. I want to highlight for you, this is what we've been showing you through the research studies. Here's Immune C. You will see 3 capsules of our Immune C product at Nature Wins, the drardisshow.com, has 1,000 milligrams in 3 capsules. Just as we showed in these research studies, 1,000 milligrams of ascorbic acid helps to lower total cholesterol, lower LDL cholesterol, and raise HDL cholesterol, your good cholesterol. This is quercetin. This is 500 milligrams of quercetin. If you're going to use quercetin, I would recommend 2 capsules a day just for cholesterol levels. That would be 1 in the morning and 1 in the evening. You can get that at thedrardisshow.com. Magnesium, we showed you magnesium plus potassium. We showed you magnesium plus zinc. We also have zinc at thedrardisshow.com. Here is magnesium at 400 milligrams per dosage. That's 400 milligrams in 4 capsules. Remember, I recommend 500 milligrams a day for everybody. So if you're going to get it from just this complex, you're going to need to take 5 of those a day, which is what I do. Here's zinc. Zinc plus. It also has copper, thank God. Zinc plus at 30 milligrams a day in 1 capsule. Now, remember, you don't have to do all of those. You can pick some of them if you'd like. Try some for 3 months, see which ones work. Or if you want to combine them all, you can do that too. But I would be remiss if I don't take you through this one phenomenal study. I did a PowerPoint podcast presentation on the health benefits of a substance called Google Lipid Resin Extract several months ago. And in that presentation, I highlighted this study. So I cannot leave you all hanging without knowing this information. I wouldn't even be able to sleep if I didn't tell you. One of the coolest things I've ever learned about in the last 8 years has been this one natural substance brought to us by God and Mother Nature called Google, Guggul. This is the title of this study. A comparative study of lipid-lowering effects, cholesterol effects, of Google and Lipitor monotherapy in comparison to their combination in high cholesterol diet-induced high cholesterol level rabbits. So what they're going to do is they're going to take these three groups of rabbits. They're going to feed one group of rabbits a whole bunch of fat raising diet. Well, they're going to feed all of them that, but one group, they're just going to feed them that stuff. The other groups, they're going to give them the fat diet. Then they're going to give them Google lipid resin extract, one group. And then in the other group, they're going to give them atorvastatin, which is Lipitor. And they want to see what's the effects. I have to show you because it's so exciting. Hypolipidemic activity, lowering blood cholesterol levels of gugu lipid, has been widely described in traditional literature. Not just a few references, widely described. The objective of this study was done to evaluate the cholesterol lowering activity of Google and Lipitor single monotherapy. So individually, we're going to give one group Google lipid resin extract, and then we're going to give another group one treatment of Lipitor. Like, they're not mixing these two. There's just a Google lipid resin treated group of rabbits, and there is a Lipitor treated group of rabbits, and the other group is just fed the fat diet. This is what they did. Male New Zealand white rabbits were made hyperlipidemic, meaning high cholesterol. They made them high cholesterol rabbits by feeding cholesterol 0.5 grams for every 2.2 pounds of body weight for 3 weeks and randomly divided into a control group and 3 treatment groups. One receiving Lipitor, another receiving Google lipid resin extract. And by the way, if you look at the dosage, they gave them less Google lipid resin extract than they gave them Lipitor. And the combination for the next 3 weeks. So they gave one group Lipitor, one group Google lipid, and then they combined the two in another group. All treated groups had significant reduction in cholesterol, triglyceride, LDLs, that's your bad cholesterol, and very low density lipoprotein in comparison to the pre-treatment values and the control group. So even when they measured their cholesterol before they started feeding them all this high-fat diet stuff, and before they started giving them the drugs and the Google lipid resin extract, all treated groups had better cholesterol levels than even the pre-treated values. So the blood work they did on all the animals before they made them fat or gave them the drugs, Google lipid resin extract by itself, Lipitor by itself, and the combination of the two all had better cholesterol measurements at the end of the study and had significant increase in HDL. All treated groups had increase in the good cholesterol in comparison to the pre-treatment values. Combination, they say here, of Lipitor and Google was comparable to their monotherapies in improving lipid profile. I repeat, they gave some rabbits Lipitor and Google lipid resin extract, and when they gave that together, its results were comparable to Google lipid resin extract by itself and by Lipitor by itself. Well, if they're all three the same and they were just as good, why don't you just do Google lipid resin extract? You don't need the Lipitor. It's just as good. All right. Now, rabbits are mammals. You're a mammal. Rabbits have livers. So do you. Livers make cholesterol. So do rabbits' livers. This I have to highlight. This product is called CardioFlow. This one we've had a hard time sourcing a few ingredients from around the world, but happy to say it's back in stock now. Thank God. It's been a few months to get this ready. The very first ingredient in CardioFlow is Google extract at 300 milligrams for this reason. If you're wanting a very simple way to take something every day that I take every day, I take CardioFlow every day. I formulated this to keep me, my wife, and my kids healthy. I don't want a heart attack. I don't want blood plaques one day or clogged arteries. So I take CardioFlow that has Google lipid extract resin in it. So I just wanted to highlight this for all of you that this is another option, Google lipid resin extract. None of these you have to get from my store. Any of these you can go somewhere else and buy. I'm just letting you know there's reasons why I carry these products, why I formulated these products. Here's our QR code for in the future if you want to be updated when we're going to do our next presentation. And don't forget our best-selling book, Moving Beyond the COVID-19 Lies, Restoring Health and Hope for Humanity. You can get that also at thedrardisshow.com. This is the Dr. Ardis Show. This is our presentation on cholesterol, what you need to know about cholesterol, what you need to know about the statin drugs and other pharmaceuticals that are actually prescribed for lowering cholesterol, and the proven health benefits of various natural substances found all over the earth and in our plants that are in supplement form that you can add to your diet that can improve your cholesterol levels and your overall risk for heart attacks, strokes, and congestive heart failure. It is my goal, it is the goal of the Dr. Ardis Show to keep you as informed as possible so you know what your options are to keep yourself and your loved ones healthy for as long as possible, reducing the risk of the toxic, deadly side effects of pharmaceutical drugs. And we've shown you several examples today of nutrients like quercetin, nutrients like gugulipid resin extract, and vitamin C, for example, that actually perform just as good or better than Lipitor and cholesterol-lowering drugs. How much more excited could you be? I'm Dr. Ardis. God bless you. I hope you have a great rest of your day, and we'll see you next time here at the Dr. Ardis Show.